All right. Hi, everybody. My name is Carolyn Wilson. I'm the coordinator for the Groton Alliance for Substance Abuse Prevention. And I'm super happy today to present a friend of mine and a great professional in her field, Heidi Gruss. Today, she is going to be helping us out by presenting a workshop on trauma and substance use recovery. As many of you know, at GASP, we usually focus primarily on primary prevention, but occasionally we do wander away from that and we get to talk about things like recovery, especially our newer initiative we started last summer, Recovery Friendly Groton. So I'm very excited to bring Heidi to the audience today, and I'm really looking forward to today's presentation. Thank you, Heidi.
Carolyn, thank you so much. And welcome to everybody who's tuning in either live on the webinar or through Facebook. Thanks for taking the time. You're going to get a lot of knowledge in the next 60 minutes, and hopefully you're able to enjoy your lunch during this time too. It actually brings me back to lunchtime on Wednesdays, where I would sit in this gray plastic chair right at the top of a semicircle where I attended my own trauma training that was a required training for all clinicians who worked in the Arbor clinic, the Arbor health system clinic that I was a part of. If you were going to be treating any clients that had a PTSD diagnosis. And the clinic director at the time, he required this training because he wanted us to go through a self-experiential process so that we knew exactly what it felt like when we were asking our clients to do this work. And what he didn't tell his trainees, though, was that we were also embarking on our own process where we were going to be uncovering and confronting unhealthy behavior patterns of our own that we had learned to live with and actually lead very successful lives with. So the trauma recovery process truly is a journey into health. It really is a way of transforming into your best self. And so for the next 60 minutes, I am going to share with you a recovery process that has proven to be effective in moving clients from a life where they're stuck in quicksand to living independent, self-caring, thriving human beings. So the goals for our training this afternoon is I want you to understand the complexity of what it means to recover from trauma. And while not every client who presents with a trauma history also has a substance use history, it is extremely rare to meet a client with a substance use history that does not at some point uncover a trauma history. We really see there's a high incidence of these co-occurring diagnoses. So to understand the relationship between trauma and substance use recovery is critical in supporting a client's long-term recovery from drugs and alcohol. So the DSM guides our thinking as clinicians to looking at trauma as experiences that threaten or even result in death or serious injury, sexual abuse. So they make sure to cover, any type of event trauma and reports of physical abuse and neglect. Those are clearly supported. Yet there's a very gray area that's related to emotional abuse and benign neglect. Yet we know the impact of this type of abuse is just as significant on the trauma survivor. So it only becomes even more complicated and more complex when the trauma has happened repeatedly or when it really it rises to the point where it's been a chronic experience. So when we talk about emotional abuse or emotional neglect, we're talking about the type of treatment that has really stifled the client. It has prevented them from being the person they were supposed to be. We often, will use the term gaslighting at times where it's appropriate. But it's this treatment that facilitates insecurity, a lack of trust, and the perception that the world around them is not a safe place. So once we've established that these experiences have happened for the client and we're using a trauma diagnosis, it is so critical to now share that diagnosis with the client. We want them to know that we're using this diagnosis and that they accept it, because otherwise we are going to keep hitting barriers throughout this recovery process if a client does not accept their diagnosis. I'll give you an example. Recently, I was working with a client. We were, she had, oh, hold on a second. She had, I don't know why that stopped sharing my screen. She had accepted her diagnosis verbally, but yet about 5 to 6 weeks into her treatment, she was having a tough time feeling like, she wasn't getting anywhere, in her homework assignments and things. And we went back to, the initial stages when she first presented to treatment. And that's where she identified, you know what, I don't think I'm ready to do this work. And it was really a critical point for the client, because it wasn't that she wasn't capable of doing the work. So we didn't want to reinforce those messages of failure. It was that she just wasn't ready. The time wasn't right in her life. And so she looked at me and she said, can I come back to you? Like, when I'm ready, can I come back? And that reaffirmed for me, she sees that this process can work. She's just not able to work it for her right now. So the answer was, of course, yes, come back when you're ready. And that reaffirms, the imprint of trauma, it may be permanent, but recovery is still possible. And we want to really reaffirm that message to our clients. So after the client has disclosed their trauma and, they have been met with empathy by their clinician, I lead them over to this trauma umbrella, and I hang this on the wall in my office. Now I have a digital resource where I share my screen, I show them this, and this is the exact process that happens. They go up to the screen, they look at it, they read it right across: anger, pain, codependency, disordered eating, yep, okay, this is starting to sound like me, physical illness, agoraphobic behaviors, like, what's that? Oh, substance use, depression, anxiety. Yeah, I've got almost everything. In fact, I was previously diagnosed with some of these things, like, and that's the overwhelming piece for the clients when they first come into treatment, is this idea that there are so many coexisting symptoms, and the common denominator is the trauma. And so I reframe it for the client and say, yes, I really feel like, a lot of your experiences, your symptoms, the conditions that you're experiencing is a result from the trauma. And instead of the client feeling overwhelmed, then at that point, they feel a great sense of relief, and it reaffirms, I'm not broken. Another analogy I use is the emotional garbage can. And, so here you can see we're creating a new vocabulary for the client. And the emotional garbage can is I use the kitchen garbage can to reinforce this idea, because in every household I, have worked with, the kitchen garbage is often the central garbage can in the house, right? It's the one where we'll take the garbages from the bedroom and the bathroom and we will empty them into the kitchen garbage can. And I will admit this, and I know you're kind of shaking and giggling to yourself, when that kitchen garbage can gets full in your house, I know you push that garbage down inside to make a little bit more room before you take it out. And I say this to my clients, and they agree. They're like, yeah, we push it down, right? Sometimes you even bring it over to the fridge, as you have to clean out and get rid of all the old food, and you put that in there too. To the point where when you finally go to take that trash bag out, it's overflowing. It stinks. There's holes in it. It might even be leaking. And that is exactly the same thing that happens with our emotional garbage can. All of those negative feelings, the pain, we stuff that down and we keep stuffing it. And as life continues to happen, we keep pushing the trash down, pushing the negative feelings down to the point where it also overflows and it leaks, except it's leaking out in the form of panic attacks and nightmares and flashbacks and self-harming behaviors, maybe urges to use, right? And so the clients can resonate with this, and we can even kind of giggle about it a little bit, you know, talking about the kitchen garbage, but they connect with it. And now this is something that they can then refer to later on in their treatment when they start to notice, you know, some of these conditions are coming back. Some of these symptoms are coming back. You know, it signals we have to check in with our emotional garbage can. And here's where the journey starts. You know, here is where we're talking about quicksand. And so the first question I ask to my clients is, you know, what do we know about quicksand? And they'll give me descriptions like, well, it's heavy. You get stuck. It's paralyzing. Actually, this morning I had a client who said, the more you move around, the deeper you go. And she said, so you have to move very carefully. And I thought, yes, that's exactly it, right? And so then we talk about the quicksand lifestyle and what it looks like, you know, when you've survived trauma, and what quicksand looks like there. And, you know, what we're doing is we're labeling common unhealthy roles that we play. You know, it might be the caretaker, the pleaser, maybe, you know, the victim. Maybe we're supposed to be the peacekeeper or the over-responsible person in our family, the parentified child, right? We're labeling unhealthy behavior patterns, you know, the things that cause us to seek approval or to neglect our own needs. Here, you know, in quicksand, you know, sometimes we're looking at a dysfunctional family system or multi-generational trauma. A lack of resources, you know, where they just don't have the means to meet their own basic needs. And, you know, as we're talking about quicksand, it's important to do a quicksand inventory with the client, you know, to get to know specifically who are the people who are in quicksand with you. Because when we're living in quicksand, we're spending time with people who are also in quicksand. You know, that phrase, misery loves company. Well, that's true here. And what happens when we spend our time with other people who are in quicksand and they're talking about their circumstances, we start to minimize or deny ourselves our own experience. And so when that happens, we start, you know, thinking, oh, you know what, my situation is not nearly as bad as Carolyn's. So, I mean, I have no space here, I don't deserve to complain or to wallow sort of in my quicksand. She's got it so much worse. And then it triggers those unhealthy roles that we've always assumed. And so we start taking care of Carolyn. We forget about our own needs and we enter into that caretaking relationship with Carolyn where, you know, we're taking care of her and trying to make her situation better. So when the client first comes in for treatment, that is where we affirm the client's decision to come to therapy as the first healthy step. And I'll ask them, how do you get out of quicksand? How does a person really get out? And they'll say, well, you know, you need something, you know, from the outside. You need someone or something. And we say, yes. And oftentimes the therapist is the first safe support that is outside of quicksand. And when the client first comes in for therapy, it is so crucial to remember that it is at that point that the client needs relief from their pain. So they are the most open to feedback from their therapist. And so we introduce the idea of the 2 tree branches that are going to help them out. And those 2 tree branches are separation and self-care. And we have to stress the importance of these tree branches because they are the foundation of the client's recovery and they carry the client through the entire recovery process. The client has to accept these things as their as part of their new life, their lifestyle outside of Quicksand. And there is an interdependency here between the two. I'm going to review them, separation first and then self-care, but it doesn't happen necessarily in that order all the time. We're looking at this from a client-centered approach. So it's very much, how do we build a separation plan and a self-care plan simultaneously that best support the client in the circumstances that they're presenting, first in treatment. So with separation, I love the word separation, not just limits and boundaries, because it is more than that. When we think about separation, we're thinking about, space, opportunity, but we separate intellectually, physically, and emotionally. And what I'm asking the client to do is to start identifying all of the things that are weighing them down and to create distance from those things. The negative influences. Oftentimes, a separation plan starts with physical separation. It doesn't have to, but that is probably the most common. And we're introducing the client to the appropriate use of limits and boundaries. In the substance use community, we often hear them talk about, the people, places, and things that are contributing to, your use, because we're trying to build a relapse prevention plan that, equips them when they're experiencing urges, but also one that's going to minimize the triggers, right? So there's a couple of pieces, though, as a clinician that we have to keep in mind here. Quicksand, I've said it's a lifestyle. It's also been the way that the client has survived. So there is some attachment to the quicksand in the beginning. So we have to be really mindful of what it takes for the client to separate. We're asking them oftentimes to separate from dysfunctional systems that have been the only sort of network that the clients had. Sometimes it's their family. That's where the majority of their dysfunction comes from. And now we're asking them to separate. That feels very threatening. So we have to do it in a place, in a way that is safe for the client. But it can also be other things besides family. It can be jobs and institutions, political organizations, religious communities. I will tell you, in the last couple of years, I'm hearing more and more about social media. So just to keep in mind, there's negative influences that come from a variety of places. But once the client has some physical separation, they've set some limits and boundaries in a physical sense, that can often be the catalyst to supporting the intellectual and the emotional separation. And simultaneously, we're building a self-care plan. And our self-care plan is where ultimately we're asking the client to not just think about meeting someone else's needs. We want them to move to making sure their needs are met first. And so when we talk about self-care and needs, we have to go very slowly here, because when we're living in quicksand, to meet our needs in a quicksand lifestyle, it means we just have the basics covered, whatever we need to survive that day or that instance. So we're not thinking of the true hierarchy of needs where we recognize emotional needs as well. So if you just ask the client, are your needs being met? They will probably say yes, but that doesn't mean that they actually are. So I will go through a full hierarchy of needs. And I've even had a couple of clients, doesn't happen often, but they've argued with me that their emotional needs aren't critical, and rightfully so. Their experience has been that they've survived without them being met. So why do they all of a sudden need to? So we have to assign some value to the emotional needs, like attention and touch and a sense of belonging and things, just in case you weren't sure what I was referring to there. We're also doing an assessment of the client's current coping strategies. So I will ask the question, how do you take care of yourself when you're not doing well? And I listen to what the client says. And that's where we're working from. The self-care plan is going to address physical and emotional aspects of their lives, and it's going to progress over time. But when we're dealing with that client who's also in early recovery from substance use, I caution you to move very slowly here. Because we need to make sure that the client is willing and demonstrating that they're actually following through with their self-care plan before we progress forward in this recovery process. And I'm going to tell you why. You cannot go through trauma recovery without hitting on the pain spots. And pain is uncomfortable. Substance use, clients who have misused or abused drugs and alcohol know that they are effective in calming agitation or dulling pain or numbing pain or reducing memories, or sometimes it's even elevating mood, right? And we don't want them going back to what they know will work. Okay, meaning the negative coping strategies. We want them to know that the healthy coping strategies will work and are available to them. So that's why we want to make sure that there's a baseline amount of self-care that is consistently being used before we move on to the really painful pieces here. And just like with separation, we're able to identify a client's barriers to separating. We're also identifying clients' barriers to doing self-care here. Sometimes it's a resource issue. It might be, money or time, childcare resources. Sometimes it really speaks to how ingrained some of those unhealthy roles are, those identities, the victim identity, for instance. And if it's that the client's not receiving any external validation for making these strides down their growth path, then that's an indication to the therapist that they need to be even more aware of when to celebrate and how, to increase the frequency of celebrating the client's progress. So as the client is doing well with their separation and self-care plans, and it doesn't just mean they're doing everything right every day. It means they're invested in the process of figuring out what feels good and what doesn't, and how to do more of what feels good. We're talking about recognition. So yes, we're recognizing what's working, but we're also uncovering all of the specific unhealthy behavior patterns for that client. We're understanding, the impact of their childhood experiences sometimes, or the dynamics in their relationships that are contributing to their belief system. We're looking at, what were those dysfunctional family values, that are familiar to them. We're identifying the triggers, and we're recognizing the unsafe people. We're also, looking at codependent behaviors, which, when we start recognizing those, it's common that the grief process is, comes into play there, because there's feelings of loss there. Think about if you're completely codependent with mom, and now we're starting to separate from mom, first physically, then emotionally, we feel like we're doing something wrong. We feel like we're walking around with our shoes on the wrong feet. And so we have to normalize that. We also have to address, the feelings of anger that might be associated with that, the feelings of loss. And, two of the biggest barriers that are often uncovered are feelings of fear and feelings of shame. And, as the client is uncovering or recognizing these different elements within, their experience, it's really important to pause and allow the client to sit with these behavior patterns, because this may be the first time that they uncovered them, because they were automatic, or they were like unconscious things. The client just did it because I don't know, that's what I saw dad always do, or, that was the company culture. So I just went along with it, not even realizing how unhealthy and negative it is. So we need to really, take the time, with the clients so that they're starting to internalize these things. But the clinician also has to remain mindful of just how protective the client may be in their motivation to label and identify some negative and unhealthy behaviors, because it may feel like they're doing something wrong, like they're outing their family. They're saying, that mom and dad didn't do a good job raising them, or, they're saying something awful about, their partner. And so it feels like they're tattling. Sometimes I'll use that language. And so we have to reaffirm, though, that the behaviors, the messages were not okay, and that it's okay to say that. So there's a lot of validating that takes place at this point in the recovery process. And oftentimes, the clients come to this sort of like crossroads, and it's not like they don't know which place to go. They are very clear that they've come for help because they want to get healthy. They want to go down that healthy road. But it's not just like flipping a light switch, like, okay, I'm committed. I'm only going down the healthy road here. Because remember, the Quicksand lifestyle is like ingrained. It's familiar. It's all they know. So therefore, it's natural that there's some spinning that goes on where the client is going down towards health and then comes back towards the unhealthy, towards the negative. And this is where there needs to have been a really trusting relationship that's been established between the client and the therapist, because not only is the therapist celebrating every baby step of progress, but it then allows the client to receive the feedback. It allows the therapist to address and confront the client on the unhealthy behaviors as they pop up here and there. And the client receives this feedback with good intention. They understand that the therapist really does want the best for them. But it also highlights that this recovery process is not a linear process, right? So it's not just, oh, we graduate on to the next step in the process, and you can't collect $200, and however that goes in Monopoly. I'm like fumbling over my words, but like it doesn't, there's no like rules here. There's no rigidity to recovery. It's very much, I want you to go out and take some healthy risks and then come back and let's talk about them. Because sometimes they're going to go really well, and other times we're going to fumble, and it's not going to go well, but that's okay. It's how do we get back up and continue to move forward? How do we adjust? And why did we start to go down that path of towards the unhealthy, towards the negative? So motivational interviewing can be a great intervention here. And then, we're hopefully achieving acceptance. And I didn't say this, but recognition. I want to make this point. When you're at the recognition stage with clients, I want you to think head, because it's all intellectual. That's what we're doing. If the client is telling you everything that makes sense to them, it's practical, it's logical, there's labels we're identifying. With acceptance, we're moving from the head down to the heart. Acceptance is all about the emotional process here. And how do we know when the client, is there? Well, they're starting to label their own behaviors. We can literally see the light bulb has gone off, and they're accepting that they have an opportunity to heal and to move forward. And there are times when, in treatment, right, it will start, the client is up here, and I'll just hold my head as I'm listening. I'm like, oh, we're here. And then we'll say, yeah, I get it. You're up here. I hear all the words you're saying to describe what's going on. I'm with you in the situation. But now I want to know, what was it like from here? And we pause, because this is like a centering process. The client needs to really get in with their emotions. They have to be present in order to feel. You don't think about how you feel how you feel. So we make sure that that's really strongly differentiated, because we're asking the client to accept their past, to accept their trauma. Sometimes we see an increase in restlessness at this sort of stage or this phase. And there's something really awesome that's taking place. It doesn't feel awesome, but I label it as awesome to give the client some relief. You see, because now they're aware up here. They're aware of what's wrong, of what's negative, of what hurts. And they can feel it, but they're not sure now what to do with it. And so it creates this restlessness. It's a sign of health, really is. And now the client is taking responsibility for their position. So they're labeling what's currently going on. It's not okay. And oh my goodness, for the first time in my life, I can do something about it. And you know, the first time you do anything, it's a little scary. And that's what that restlessness is about. And it hangs on for a little while, because you know, the first few times we rode a bike without training wheels, it was a little scary. We were a little wobbly. So that restlessness will come out. But again, the client knows that they're being supported. You know, they're being validated. They've created self-care, and they're using limits and boundaries. So now they know how to respond to this. We also want the client to accept that now that they've recognized you know, all of these negative things, including they're starting to recognize their feelings, that the job isn't to fix them. See, when we are internalizing everything, we're embracing. We want them to embrace their whole being. And how this happens is we give the client space to keep retelling their story. And every time they retell their story, they unload a little bit more of that emotional trash can. And every time they retell their story, there's a new layer of recognition. There's a new layer of awareness. And every time the client retells their story, they're building a deeper level of trust with themselves. And it's so beautiful to see. And they're accepting now that recovery is a lifestyle. It's not an event or a point that they're trying to reach. It is now how they're going to live their lives. And so they get in the flow, right? Where self-care and separation are feeling good. They're demonstrating consistent use of their plans, and they're progressing in these plans. They're demonstrating a commitment towards health. They're achieving emotional separation. And the greatest vulnerability here is now they're accessing deeper levels of their emotional pain, but they know that they're safe. We now see this belief in self to meet their own needs, because they're seeing their self-care plans are working. You know, they have this toolbox now and they're using it. And so simultaneously, remember, this is a process, we are developing the healthy belief system. We're going back to all of those things that we recognize that were, you know, negative or unhealthy, and we're redefining them. You know, maybe during the recognition phase, you know, we uncovered the definition of love is pain. You know, love is conditional, love is unreliable, unpredictable. Well, now we're reforming the definition here. And the client might use words like, you know, love feels unconditional, and love is safe. Love is forgiving. I love that one. And so the client has created some safety, and it is taking some healthy risks here to reaffirm this healthy belief system. But I will also ask them, like, I want you to label, like, what were the family values that you had, you know, as a kid, you know? So whether or not there was childhood trauma or not, I'll often go there. And then I say to the client, okay, now which of those do you want to bring forward with you? Especially if the client is a parent themselves, you know, I'll say, like, what of those values do you want to use with your own kids? and it really gets them thinking. And what I'm doing is I'm giving them permission to take what feels right for them, what they place value in as they're creating this healthy belief system. I'm letting them be the chooser, be the author, have the power to do that. And along their journey, when we're talking about developing safe supports, we're seeing that the people that they're choosing to spend their time with are healthier people. And they change, it's a process. They might, when they first come out of Quicksand, they might have a healthier support. And as they move through and are building that healthy belief system, their supports might be even healthier than when they first started their recovery process. But it's important that we reinforce, your safe supports, they need to be supportive of you on your growth path. They need to embody those values that you just told me were critically important to you. And so I'll ask them, does this person qualify to be in your life? Because for the first time, the client has standards. In Quicksand, the client just wants everybody to like them. In fact, they approach new relationships with this mindset of who does this person want me to be? Because I'm going to be that person so that they like me. And now the posture has changed where the client is saying, this is me and this is what I want out of a relationship, friendship, however you define it, right? And I had a client say to me once, as a friendship sort of ended, and it was a healthier friendship for her. I said, what happened? And she said, I don't know. I wasn't their cup of tea. And I was like, yes, that's okay. She wasn't mad. She wasn't angry. She didn't feel rejected or abandoned. She was like, we didn't jive, and it was all okay. A sign of help. Reconciliation is also a really critical element in the recovery process. And when I use the word recognition, I'll define it as the process of accepting the dysfunctional family or the dysfunctional friends, the unhealthy belief system, the abuser. It's accepting them as they are. And thereby we're neutralizing that negative energy that is attached to the abuser or attached to the unhealthy belief system. And so, yes, the client has accepted this emotionally, but now we're sort of shifting their awareness even more, where we're able to bring some closure to what has happened to them. And, sometimes they have to just agree to disagree. Because sometimes the reconciliation process, it will actually involve people. There's direct communication, other times it's more passive. The client can reconcile without needing to have any interaction with their abuser. But it's important to distinguish that we're not using the word forgiveness. I've actually found the word forgiveness to be very triggering of trauma patients because their perception is we are sending a message that what they did was okay. And we have to be very clear that the treatment wasn't okay. And I feel like that is so appropriate here. But to reconcile means we're really releasing the blame, the resentment, the responsibility, and the client is able to validate themselves. I had a client share with me, this was just kind of the reconciliation process with one of her relationships was hard. And even though she was intellectually aware that the dynamics in the relationship weren't about her, there was all of a sudden this aha moment where she was able to see the other person's actions and behaviors and say, hold on, this is their process. This has nothing to do with me. I literally heard her verbalize, I'm releasing myself from this. I have nothing to do with this. And it was such a freeing, liberating moment for her. And it brought about her inner peace with this relationship. And so just like we talked about We can't get rid of unhealthy coping skills until we've adapted healthy coping skills. We can't totally shed the unhealthy belief system until we've actualized the healthy belief system. Same parallel process here. And what we're doing is we're replacing it, right? And we know we can do that because the client has a fully developed healthy belief system. They've accepted their own personal identity as separate from other people. They're okay, when their partner doesn't share the same point of view as them, or, when their family doesn't agree with their life choices. They understand that they're still safe and they can validate and continue on down that path. And what we're doing here is we're giving the client permission to now live as an independent, self-caring, thriving adult, where they're fully involved in their life and their life planning. They're excited by risk, excited by change. I mean, change is difficult and uncomfortable, but they're not afraid of it, is my point. They know they can go and make mistakes and it'll all be okay. They're able to start making goals and working towards achieving them. They see the opportunity in life. They accept that there's a solution to every problem. One of my favorite affirmations that I use with clients is, I will always find a way. That's part of that belief system now. And so the client embodies, self-awareness, self-acceptance, self-responsibility, and self-reflection. Those are my 4 S's at this stage. And it really is my favorite part of this entire recovery process is that the clients graduate or, leave therapy with this toolbox that will forever be theirs as they continue on, through life and enter into different phases of life. They always have this toolbox now to support other things that they're going to continue on doing. And so what's really important in this recovery process is, and I love this quote, is it doesn't matter how fast, there's no, you don't get something extra if you go through this process in, 3 months, 6 months, a year. It's just the courage to keep showing up and moving forward at whatever pace feels right for the client. So in this pandemic, I actually saw the opportunity to create some digital resources for clients. So I know we have a very mixed audience today, but any people who here are saying, yes, that's me, I am in Quicksand and I want to get out. I do have a 6-week virtual course that does include personal time with me. So, to help you moving towards that self-caring, thriving lifestyle that you're looking for. So feel free to connect with me through email or through my website. I would love to hear from you, as well as I hope you guys are commenting and giving some feedback through the chat or on Facebook, because I'd love to hear that too.
Wow. Well. So Heidi.
Yeah.
I have been taking notes through this entire presentation, and I have a lot of things that I'm processing about all the stuff that we learned today and the different ways we can apply it, especially for me being in prevention and the scope of the work that I do. There were so many key takeaways, and I just want to highlight a few things if you don't mind.
Sure, yeah, please.
First of all, I want to just say that in this presentation, I feel there's something for everyone to learn. So in the prevention world and coalition work, we gather people from all different sectors of the community to do prevention work. And we have clinical people, non-clinical people, people who work in agencies, a little bit of everybody, lay people, kids. I mean, we really do have everything. But one thing I really love about this presentation is I was able to extract so many things that I think will be helpful for the audience.
Mhm.
So one key point that you made that I really love, and it totally fits in with our recovery-friendly Groton initiative, is recovery is a lifestyle, right? So when we're thinking about recovery-friendly communities, we're thinking about places for people to learn and grow and to live their life, communities that are supportive of that process that we outlined, that you outlined. Normalizing help-seeking behavior and knowing that there are people out there that can help, that know about this stuff. Understanding the process. So if somebody's, tuning in and does not have a clinical background, they can see what this process might look for somebody that they know or care about, or maybe an employee, which is huge. Because when we talk about recovery-friendly communities, you look at that from all these different perspectives. So I think as a community, it's important that we promote help-seeking behavior, that we support treatment in whatever forms it might take for somebody, just like we would with any other disease. I think that that's super important. I think also sometimes in prevention, we talk around trauma and recovery because most of us are non-clinical. So we speak about these things being important and something that matters in prevention, and that, we want to, have a nice community where everyone feels productive and safe and happy. But it's really important to frame these things out and have a deeper understanding, because talking around these things, as talking points or catchphrases, it doesn't do anybody any good. And I don't know who could watch this presentation and not have a deeper understanding of trauma-informed recovery would be. From a clinician's perspective, I would imagine if there's any clinicians tuning in, even some of the topics about self-care, from their own perspective, we know that there's a lot of burnout in the field from, drug and alcohol counselors to social workers to people who work in recovery homes. So staff at like a sober home or an outpatient facility or an inpatient facility, in addition to whatever they deal with internally, they are working with other people who also have it. So I was thinking about that a lot as you were speaking.
I'm really glad, Carolyn, that you're bringing that up, because I will tell you, when this was early on in my career. This was my first job working in the Arbor Health System. And, it was annoying to have to take, in the beginning, I thought it was annoying to have to take my Wednesday lunch hour every day as a non-billable hour and go and sit through this, experiential training, where I was being asked to do a lot of this work and to acknowledge my own self-care and, my own routines and behavior patterns. But let me tell you, it was the greatest gift. It really was. Because I don't know that I could do this work without walking the walk too, and I only created or assigned value to that because it was a value within our clinic. This is how we take care of ourselves, and because we're modeling exactly what we want our clients to do. And so I'm really glad that you're bringing up that point. Mm-hmm.
Right. And another thing that I'm thinking about what makes a recovery-friendly community. Obviously, like I mentioned before, help-seeking behavior. Taking the stigma away from that, knowing that trauma is way more prevalent than anybody chooses to recognize, simply because of the fact, the shame and the fear that you mentioned. People don't really want to talk about it. Nobody waves a flag saying, I'm a trauma survivor, because it's nobody does that. And we know that it's pervasive, and we know that it's the ground level of a lot of mental health issues and substance use issues. I mean, that's without a doubt. So, you know, it's funny, like once again, coming to the non-clinical person that I am, in prevention, we have to acknowledge that even though I'm not going to ever, you know, provide treatment to anybody, the scope of my work needs to include that. You know, sometimes casually I'll say like, oh, people just need to stop messing up their kids, right? But, you know, that's how, you know, I feel personally, but there's no way for me to reduce the amount of trauma, right? So in prevention, we talk about health facts. We talk about what you can expect if you use substances, you know, the different consequences. I can't, and my coalition can't do anything to prevent trauma. Like we can't. We can raise awareness of it and understand that it's a problem, and then help encourage people to get, you know, early care and continuing care if need be. So, you know, it's so important. And of course, empathy. You know, there could be people tuning into this that really just don't get it. They know it's important. They might talk around the issue. They may not themselves have felt any trauma, but let me tell you, if you're a teacher, if you're in law enforcement, if you're, I mean, if you're an employer of any kind, you want to know about these things, because what if you have an employee that's struggling? You know, how are you gonna interact with them? You know, what kind of employer are you going to be? What kind of workplace? Are you a health promotion oriented workplace? Do you have assistance programs ready to go? Do you have a resource list? Like, these are all things that we can do to promote the help seeking and normalize it, so, you know, people have their best shot at getting better and being healthy and productive. And so huge.
Yeah. Thanks for, you know, having some flexibility with putting some trauma into your series, because you know, all the work that I've done, you know, even statewide, managing some substance use contracts, I mean, we never executed any type of program without talking about trauma. I mean, we always knew that that was part of the population we were serving. So I appreciate and value your time and attention towards the trauma piece.
Terrific. Okay, well, I'm not seeing any questions from our viewers, but people will have another opportunity to see this, of course. And of course, you have your information up there if anybody has any questions.
All right. Well, everyone can enjoy the rest of this beautiful Friday afternoon. And thanks again for everyone who attended.
Awesome. Thanks again, Heidi. This was great.
All right. See ya.
All right.